Lucy, who are we waiting for?
I'm sure somebody already said thanks for being here, but no, really, thank you for being here. Hodan is in. She was having a little bit of trouble. I just texted Sudarshan just to make sure that he is okay, but he's not until the second half, so we have a few minutes
Okay.
for him. So
Houlei's good.
I think we're ready.
Good afternoon, Columbus. Thank you for tuning in to our COVID-19 Immigrant and Refugee Response Roundtable. I'm Columbus City Councilmember Emmanuel Remy, and I have the honor of hosting today's live event. We have split this discussion into two parts. First, we will learn about the Columbus City Council-sponsored COVID-19 Safety and Resources PSA videos and hear from folks who made these videos a reality. The second part will consist of 4 powerful advocates and leaders who have been serving their communities during the COVID-19 pandemic, moderated by Rebecca Nelson of Columbus Public Health. So what are the COVID-19 Safety and Resources PSA videos? A few months ago, Welcoming America, a national nonprofit dedicated to connecting leaders and building and expanding local programs to create and promote more inclusive, welcoming communities for immigrants, announced the Resilient Rapid Response Initiative, offering a grant for up to $10,000 to help organizations and municipalities expand access to their COVID-19 related information for limited English proficiency residents. Columbus is one of only 10 cities across the country to receive this grant. Thanks to this funding and my equivalent match, and I apologize for that. I got it. I was rolling along too. Just one second. There we go. Thanks to my, sorry about that. Thanks to my equivalent match, Council was able to legislate $20,000 to create COVID-19 PSA videos by partnering with Tarik Tarey, the producer and creator. Let's go ahead and show one of the PSAs right now before speaking with Tarik.
Hello, friends. I'm Columbus City Councilmember Emmanuel Remy, and today I'd like to bring you safety and resource information in your native language about COVID-19. We value everyone who calls Columbus home and hope that you find this information useful. On behalf of Columbus City Council, please stay safe.
Bonjour, je m'appelle Houleye Thiam et je suis venue encore parler à la communauté par rapport au COVID-19. La première chose que je voulais dire, c'est que le Covid est toujours là et que le Covid est toujours parmi nous. Et nous remarquons que le nombre de cas augmente par rapport au début du Covid. La deuxième chose, c'est par rapport à la loi du port du masque dans l'État d'Ohio. Quand vous sortez de votre maison, il y a une loi dans l'État d'Ohio qui dit que vous devrez absolument porter un masque. Les symptômes du Covid sont le problème du frissonnement, les maux de tête et la fièvre. Ce sont toujours ça, c'est ces 3 qui sont les symptômes du Covid. Les maux de tête, le frissonnement et la fièvre. Alors, si vous habitez à Franklin County et que vous voulez un COVID test, vous l'aurez gratuitement. On va partager les informations par rapport à où vous pouvez aller pour obtenir ce test free, comme on le dit en anglais, et gratuitement comme en français. Et si vous prenez le test COVID, vous serez obligé de vous mettre en quarantaine pour 14 jours, le temps que vous obtenez le résultat de votre COVID test. Et si vous êtes positif, si vous êtes testé positif du COVID, il y aura un appel du Department of Health qui va vous prendre des informations par rapport au contact que vous avez eu durant les 14 jours, le temps que vous avez eu le COVID. Alors, c'est important et recommandé cette saison spécialement de prendre ce qu'ils appellent le flu shot ou le vaccin de la grippe. Vous pouvez l'avoir gratuitement au Department of Health. On va vous subvenir des informations, des numéros de téléphone et de la location du Department of Health de Columbus, Ohio. Si vous avez besoin de quelque chose, si vous avez besoin de la nourriture, si vous avez besoin de quelque chose, s'il vous plaît, appelez 211 ou LSS qui vont vous aider à avoir les ressources nécessaires pour subvenir à vos besoins. Merci.
Yeah, I was going to say, Lucy, I'm assuming if she's watching the stream, she should be able to tell.
Yeah, I'm watching. I'll tell you when it stops.
Okay.
I can certainly try to catch it up so that you can, sir.
It's okay. Just let it broadcast on CTV and
I
just let me
think
know.
you should go ahead.
Okay, it's done. What would we not do without technical difficulties in 2020? So wonderful. Thank you for airing that video. I think most of the audience got to see that. So Tarik, artist, producer, filmmaker, and community leader, truthfully, there is nothing that you can't do. Thank you so much for joining us today. Could you please introduce yourself and tell us how you became involved with this project?
Well, first of all, I really appreciate your leadership, and I appreciate you giving me the platform and giving us all the ways to communicate with our communities. My name is Tariq. I am currently the Director of Refugee Services at Jewish Family Services, an agency that has been around since 1908. It's been helping refugees for a long, long time. My other hat that I wear is I focus on visual ethnography. Basically, what that means is focusing on people who are coming to the United States and needing the help that they do. When COVID happened, we took into action. I focused on making sure that the information was disseminated to the refugee and immigrant population. As you all know, being a refugee is living in refugee camps after you leave your home for 20 years. Education has been disrupted. Most of the refugees are coming to our country with not only with limited English, but also their own language of reading and writing might be an issue. So most of the stuff was being translated in writing was sometimes not being disseminated accurately. And someone with my background, I made sure that I partnered with people from my community, from other immigrant communities, and definitely the city Councilmember Remy as well. So it has been a very success. And the languages that we focused were the majority languages that are in Columbus, which is Somali, Nepali, Spanish, Arabic, French, Fulani, and Russian. We figured if we tackled those languages, we will be covering quite a bit of information to be disseminated accurately and as quickly as possible.
Well, we certainly appreciate that. How did we decide on the content?
I think one of the amazing things with this partnership, obviously your office, Rebecca Nelson's office, and many community leaders, such as Community Refugee Immigration Services, such as Us Together, we had a long conversations about what information could be. And we could not do anything without the city health officials to make sure that the information that is being disseminated to the general public also gets disseminated. So some of those were obviously safety, Councilmember, and testing locations. That was one huge issue that we wanted to make sure that people understood where to get tested. The other thing was contact tracing, people not to be nervous about when people call them, to make sure they answer the phone accurately and give that information. And one thing that a lot of people missed, I think, is the flu shots. And thanks to Rebecca and Rebecca Nilsson's office also making sure that that was included in that conversation, because flu shots go hand in hand with other primitive. And the last one most important thing is most people are hurting both economically and resource-wise. So 211 was included in this script originally to make sure that that information was accessible to our refugee and immigrant population.
How did we choose the speakers, and who they would be for each language?
One of the wonderful things that happened, obviously, as you know, it takes a village to make sure that this information is accurately represented to the communities that we're disseminating. I myself have been involved in refugee communities through Jewish Family Services for 18 years, so I know the community. I know who's coming in based on my relationships with Us Together, the Settlement Agency, and Chris, and ETSS, and our Somali community partners such as Hodan and everyone else. So we do know who's credible. We do know who has weight in saying those words, and people need to be trusted. You can't have just anybody. You have to have a community leader or someone that in that space, and we had to make sure that they have the credibility to their communities to disseminate that information.
It's just remarkable, how they all came together and the look. And of course, a lot of that has to do with your creative eye as well. Next, I'd like to call on Houleye. Houleye, good morning. Good afternoon, I guess, at this point. I know that you were very involved with the Mauritanian community here in Columbus. Please tell us about your work and why it was important for you to lend your voice to this project. I think you're on mute.
Yes, I think we're good to go now.
Yeah, there you go.
Good morning, Councilmember Remy. Good morning to the council, and I'm so honored to be here. And good morning to my brother Tariq and everyone who's here today. You talked about my video is blinking for some reason. I guess that's part of the technical difficulty.
Special effects. It's a special effect today.
You talked about my work in the Mauritanian community. It's important for communities to organize, because as Tariq said, when you come here from as a refugee or as an asylee, there's so much trauma that you went through coming here. And once you come here, even if you didn't go through trauma, there's a lot of learning of the new culture. There's a lot of things you don't know. So, and usually what immigrants do is one person goes and then the next person follows. So people live in communities in different cities because that's where the trusted leaders are. That's where the community feels safe. So it's important for those communities to organize themselves to be able to share information. And that's what we did with the Mauritanian community as well. We created what we call the Mauritanian Network for Human Rights, which is the biggest community organized Mauritanian organization in the US. It's represented in about 7 different states. And in each state, we look at organizing the people locally to let them know what information is available to them, including the COVID stuff, but also let them know what they can do to make sure that their voice in those local communities is heard by the city leaders, by the elected officials in those, and let the elected officials know that those Mauritanians are there. It's important to know that they're there, and it's important to let people know what specific needs Mauritanians have to be able to get those needs met. With the COVID specifically, when it first started, our biggest issue was communication, making sure that people who did not speak English or read English were able to have access to the information, but also to the right information. So this was way back in March and April, way before the video started with Tariq. My organization went to the CDC website. We got the information because there was a lot of rumors about COVID that were not true. So we had to go to the source, make sure we have the right information, and make sure that we translated it in audio format in 4 major Mauritanian local languages, which were the Fulani, the Wolof, Soninke, and Arabic for the biggest population of the Mauritanians that are living here. Those are the languages that they speak. we were able to translate those in audio format at the time, and we were able to really widely spread those videos to make sure at least people had the basic information about the COVID.
Thank you for that. We appreciate that insight on that. This next question's for both of you. Why is the PSA project essential, and how will these videos help the community as we continue to face the relentless pandemic? I mean, really, arguably, we're at the height, the peak of the pandemic as we roll these out.
Houleye, happy to jump in if you don't mind. So it's a great question, Councilmember. I think as I've stated before, communication has to be a dual track, one in writing and one in visual communication. As I was saying earlier, many of the immigrant and refugee communities that are living in the United States or in the city of Columbus really has, education has been disrupted. So some people are not going to read the information that has been disseminated through writing format and written format. Communication on audio and visual, we thought it would go a long way. Folks communicate through WhatsApp. There's huge WhatsApp group communities that share information. We thought if we could send the PSA through that format will be very helpful. And also we made sure that the formats, the PSA is very short, concise, so it could be shared through megabyte wise. It will be smaller for you to share through either Facebook and other communication. The important thing also is that the credibility of the people, as I said earlier, was also important. Leaders, people who have worked with the community for a long time. And I think it was crucial for us to use those folks.
And what I wanted to add was, of course, I right on everything that Tariq said. I agree. Only other thing I wanted to add is it's important for these communities to see that they are represented in this fight against COVID. It's important that they see trusted voices in their communities speaking their own language, speaking to them about why this is important. And the other thing, I was speaking to one of my community members, and it was around April when the governor was doing the press conference every Tuesday, and there was so much talk about that. And I said, do you watch the governor's conference? He speaks a little bit of English. He said, yeah, you could watch the governor speak all day, but if you don't understand what he's saying, that doesn't do any good to you. So it's important to be able to, again, translate whatever the governor is saying and to get the trusted information from a trusted source and put it in the hands of the trusted leaders in these communities to make sure that they get the right information and to show them that we are all in this together, that no one is being left on the sidelines in this fight against COVID.
Councilmember, if I may add one last quick point here, I will really echo what we just talked about, and that is representation. Many people from either Minnesota or even outside the United States have called me and said, look, you're representing people from the community. The city of Columbus is representing the people that look like us. And that could potentially translate that people could relocate here once they see themselves, the city logo and representative and official elected saying this is the kind of people that we're serving. People would say, look, I want to leave this town that doesn't represent me and I want to go to Central Ohio. Therefore, we could grow our economy, hopefully. So it's not just a PSA. It's a form of marketing for our city that we are inclusive. We welcome diversity. We welcome languages. We welcome religions and different populations as well.
Thank you. That's an excellent point, and I really appreciate both Houleye and your points on that. My final question, again, to both of you: what obstacles, including myths and misinformation, are you hearing from the community? In any community, there's always those who are skeptical
skeptics on science and everything else. To us, my focus is to get the information to the people as quickly as possible. And if we do that, we will be saving lives. Our next phase right now, I have started with a short Somali PSA about the vaccine. And my goal is private and public partnership to cover the cost of these things will be amazing, because many people have been doing studies on the number of people that are skeptical about the vaccine, and the numbers is not looking good, and especially in our community. And we need to make sure that the information gets disseminated as quickly as possible, and also the accurate information, and also officials like yourself or somebody from the mosque or somebody from a religious leader from other communities, taking the vaccine themselves to see this is who my leaders are doing, and hopefully that will go a long way. So, Councilmember, that's a great question. We really are thinking the planning of the communication with vaccines and making sure that it's safe for you. That's the PSA that we're working on next.
Houleye, any misinformation that you hear going on out there, and what we can do to help solve that problem?
I was just going to add that some of the misinformation and some of those rumors that I've seen a lot in these WhatsApp groups, which are huge in the immigrant community. At least I know that for sure. In my community, everyone is on WhatsApp, and there's these groups where people have discussions about all kinds of interesting things. And they're huge. You see a group that has 250 people, 150.
I spoke to a Somali group that had 450 on one night. So, I mean, it's
amazing.
A deal. Yeah.
So it's a challenge. It's an opportunity and a challenge. It's an opportunity to be able to share information quickly with these communities, but it's also a challenge because when there is misinformation, it spreads quickly in these groups. And one of the few things I heard at the beginning, thankfully this has now dissipated, was that COVID is made up, it's not real, it doesn't affect Black people and all that stuff. So when you hear that in these groups, you have to have information to support, to say, no, that's not correct, but also to be armed with the right information to say, this is the right information. This does affect everyone, and I don't think anyone has any interest to make up some virus just so you could kill people. But you also have to have the discipline to listen to these voices. And Tariq was talking about the vaccine. This has already been, the information about the vaccine being real, or that it was too soon to develop, or that that no one should trust this vaccine. Information like that has already started spreading out. Again, people have to be ready to be able to have the right information to show people that it's important to take this vaccine, and show proof and show that volunteers have taken this vaccine, and really let people know that we are all in this together. There's not one person who's left in this fight against COVID-19, because we are all affected in some way, shape, or form. And we all have to play our roles in our communities as immigrants to make sure that this spread stops, because we are all affected.
Very good points. Tariq, we'll be working with you, of course, to make sure that funding's there to get the vaccine information out, and call on our health partners, like some of our major health organizations, to help support it as well. Thank you both for being here today. Thank you for your insight and your work on this. It's been certainly appreciated. We obviously couldn't do it without you, but it's important work, as we've talked about and discussed. I'd like to recognize Council President Hodan, who has joined us today, and thank him for tuning in so that we all, have the opportunity to hear this information. Council President, would you like to say a few words? No, he's all good. Appreciate you stopping by. Now we're going to transition into the second part of this roundtable discussion, and I will pass the mic, quote unquote, over to Rebecca Nelson. Rebecca, thank you so much for being here today. Thank you for your work at Columbus Public Health. We certainly appreciate your partnership.
Thank you so much, Councilmember Remy. both for your service to the city and specifically for hosting this COVID-19 Immigrant and Refugee Response Roundtable today. As you've shared, my name is Rebecca Nelson, and I'm here on this roundtable today representing Columbus Public Health and as the moderator of Part 2. It is my pleasure to share space with these community leaders on the call today. I'm going to go through and very quickly introduce our 4 panelists, and then we'll kick off with the first question. We have 4 leaders with us to discuss how they have been working with immigrant and refugee communities in Columbus. And they are Zerqa Abid with My Project USA, Hodan Mohammed with Our Helpers, Sudarshan Pyakurel with the Bhutanese community of Central Ohio, and Ramona Reyes with Our Lady of Guadalupe Center. Thank you so much to all our panelists for joining us today. The first question involves a little bit of introducing yourselves as well. Could you please tell us about your work with the immigrant and refugee communities? What are the challenges your organization is facing, and what successes have you had around COVID-19? And I'm going to go in reverse order that I introduced everybody and ask Ramona Reyes to kick us off, please. Thank you, Ramona.
Thank you, Rebecca. Thank you, Councilman Remy and City Council for the opportunity to share a little bit about the Our Lady of Guadalupe Center. The Our Lady of Guadalupe Center was first started in 1999 as a food pantry, and in 2016 we expanded our services as a response to Hispanic barriers to success, including a 43% poverty rate, low-wage jobs without benefits, immigration uncertainty, discrimination, lack of healthcare, lack of education, and language barrier issues that impact the successful integration to the U.S. Our clients already had all the challenges and chronic stress associated with poverty, and most have additional complicated needs. For the Hispanic immigrant community, the Our Lady of Guadalupe Center is a trusted entry point to getting the help and getting connected. Thanks to our reputation and culturally competent practice for the last 20 years, as new Hispanic immigrants arrive, they learn about and come to the center. Because our clients trust us, they also trust our partners. We have built a network of community partners, which is important because for our clients, one crisis can spark other issues. For example, a loss of job becomes an eviction notice that sparks an anxiety attack, and that can surely impact the whole family. So working together, we can focus our services on our areas of expertise while comprehensively addressing the interconnected challenges of poverty. Our ultimate goal is to empower our clients with a whole person support that will help them become fully active participants in the social and civic life of their communities and achieve economic self-sufficiency. We work toward this goal by providing a resource center that targets Hispanic immigrants' unique needs. We focus on health and nutrition, economic development, community building, and family strengthening because these are the areas we have found through our 2 decades of immersion in the Hispanic community on Columbus's West Side are the foundation for our clients' success in job attainment and improving overall health and well-being, which leads to stability. With a team of 4.5 employees and through all these programs, in 2019, we served over 3,200 clients, of which 98% of them were of Hispanic background, and provided over $300,000 in emergency assistance services such as meals, clothing, legal assistance, rent, and utility assistance. And since COVID, have seen over a 35% increase in needs.
Thank you, Ramona. Sudarshan, the same question to you. Tell us about your work with immigrant and refugee communities. What are the challenges and what are the successes?
First of all, thank you, City of Columbus, for putting together this event. This is very important, and I think we need to do more of this as we move forward with the COVID vaccine and whatnot. My name is Sudarshan. I am with the Bhutanese community of Central Ohio, and we have been very blessed to be in Central Ohio with amazing leadership through City of Columbus, and Emmanuel Remy obviously is a big champion with the new immigrant community. And thank you to Rebecca Nelson also for hosting, being a host today. As Ramona said, we have similar challenges in the immigrant community. Witness Community of Central Ohio is an ethnic-based community organization that supports newly arriving refugees from Nepal and Pakistan generally, but we also open our door to other communities that live nearby. So we have been serving not only Witness community, but also other communities in as much capacity we have. We are a small organization. We are 5 staff, and we provide post-resettlement service. That's a key word. What we do is, and there are resettlement agencies like Us Together and the CRIS, Community Refugee and Immigration Services. So we step in to fill in the gaps where we partner with resettlement agency and county and other local nonprofit organizations to provide that critical support for refugees who are in the process of transition. And you might have heard great success stories about refugees. They do, and amazingly, a good number of refugees get through that transition phase that could be 1 year, 2 years, and into the mainstream community. And they buy home, they start new businesses and whatnot. They had made amazing success stories in Central Ohio. But our focus is onto those, roughly we have calculated around 10 to 12% refugees who do not, who have challenges because of the mental health, trauma, their age and language barrier. That is where we provide additional services to them. And additional services includes, could be case management, mental health services, school, family, employment, the list goes on and on. That was our regular job, but because of the COVID, things have drastically changed. And currently this year, we heavily focus on providing relief for the COVID. And I think we'll talk about that one later on. And that's what we do and we've been doing. And thank you for this opportunity to share about Witness community.
Thank you so much, Sudarshan. Next, we have Hodan Mohammed. Hodan, could you also share with us your perspectives around the work that you've been doing, the challenges your organization is facing, and what successes you've seen?
First, thank you so much, Columbus. And again, thank you so much, Rebecca and Councilmember Emmanuel Remy. I am very blessed to be here with you today. My name is Hodan Mohammed. I'm the founder of a nonprofit organization called Our Helpers. Our Helpers is a nonprofit organization, and our main goal is to help immigrants overcome social and economical obstacles through education, advocacy, and job placement. Our organization has been affected as every other organization financially, and we're sharing the same effect. Some of the success that we have achieved, we were not able to achieve what we could achieve due to a lack of resources, but some of the things that we have done so far, as we first thought about, we're closing the doors because of the COVID. So we have been helping more than 5,000 clients that we were the main source. So we thought about them. We opened a community Bal Talk where they can come together, and then we can connect them to Somali doctors that speak the same language, health professionals, including Columbus Public Health employees like Hibo, who speak Somali, connected them to their elected officials, including Emmanuel Remy. So we were very helpful connecting the community to their resources in Columbus City. That was a good achievement. We're still doing that, though we're not able to do 5 days. We used to do 5 days, but it became hard. So now we do only Tuesdays and Fridays. Tuesdays is for health issues, talking about how COVID is going, what we can do. And when Hibo is leading that project for us, we're very thankful for her. And Friday is only for youth, since we're having a lot of issues and gun violence in our city, specifically immigrant community. So Friday is for that. But we're back to in-person services due to immigrant community, it does not work for them virtually. So we have to come and help them in person again. So we open our doors for them again, and we're helping in person. We have been giving out hand sanitizers and soaps, masks, with the help of other partners, including City of Columbus. We're still helping and trying to help the community. Some of the success was not only our helpers, there's also global health education and development led by Marian Duale. They do tutoring, they do education videos, including mental health education. So different people within the community are trying to help in different ways. So then these are some of the success that we have done so far.
Thank you so much, Hodan. And now we move to Zerqa. Zerqa Abid, could you share your perspectives on what your work has entailed and the challenges and successes?
Good afternoon, everyone. Thank you so much for having me on this. And I cannot appreciate enough City Council and the leadership of Councilmember Remy and everybody else on Council. And also to you, Rebecca, for your role on your department and how you have gathered all of us throughout this pandemic. And I really, really appreciate those guidance. My name is Zerqa Abid. I'm the founder and executive director of My Project USA, a nonprofit focused on Hilltop area, but the rest of the Columbus we serve. There is a longer list of what we do and how we have accomplished. I'm gonna try to do as quick as I can. That My Project USA is serving to a diverse population, including Somali Bantu, Somalis, Arabs, Afro-Americans, Hispanics, and everyone else. 65% of our clients are Somali Bantus, though. And total number of clients we served this year so far, actually up till 30th of November, was 40,000. Estimated volunteer hours were 8,000 hours, which are way less than what we do normally in other years. We serve through food pantry, tutoring, mentoring, counseling, reading, warriors, career counseling, shooting. We started new program for youth and also adult of shooting, like Dress for Success program, ESL classes, recreational soccer, and running project also started this year. The challenges part, I would say, is the money. The most important challenge I'm seeing right now is that although we borrowed money from SBA, we had a great support of $170,000 from the CARE Act dollars. Still, all that money is gone. All the grants that came from Columbus Foundation or anywhere else in donations to support the community is gone now. And I'm having serious issues in how are we going to continue with our operations, the payroll, the rent, the transportation, the utilities in coming months. Children mask has been a challenge of also they are expensive, and we have like thousands of children who need it, and they need to be replaced every once in a while. So children mask, social distancing also has been a challenge in this pandemic, because the nature of our client, if you're for social distancing, you need a bigger space or you have to do it outdoors. So either way, there have been challenges and more expenses. The other thing that is the HVAC expenses in the building. So we have moved to a new building, and now something that we never calculated was that it may cost us about $45,000 just to have proper HVAC in the building if we want to do youth program that is safe through pandemic, and we can continue serving our youth. Online work with youth, and which is why we need a space which is safe, has been a challenge. I commend a school district for their awesome job at how, as much as they can pull themselves together in providing things, but it's still online work with youth on our side, providing them help, tutoring, all of that is a big challenge. Lack of volunteers, because of pandemic, our own volunteers have been impacted by COVID, their family members. So every other week we had this issue, we had to increase number of paid people. Our pantry never had paid labor before, but this year we had to hire people and pay people to do this work. Price of PPE gears is also a big challenge, because the number of clients we serve is huge and they cannot afford these. So continuous supply of those gears is a challenge. Distribution of essentials and goods while keeping them COVID safe. We do code drive. We passed this year in Ramadan. We did not pass the hot meals, which we do. We only passed it to 35 or 40 individuals every day because they could not cook for themselves. Otherwise, every year we used to pass about 4,500 meals just during Ramadan. And the same thing was with the toys or now the code drive. How do you keep them safe and clean and serve, and pass it to the community has been a huge challenge during COVID. Success part is a long list. Alhamdulillah, is the number one thing I did in COVID is that the major success is that we organized community through grassroots leaders. So as soon as COVID happened, my soccer coaches who are from the community, Aiden Mohammed and Sihat Mohammed, I turned them into the community organizers and outreach directors immediately. Because even if you have Somali videos from Tariq or anywhere else, or Somali literature, it's useless for this Somali Bantu community because of my. It's a different dialect, it's miscommunicated, it doesn't give them right information. So we used our own videos. We made videos in our own store just through Aiden and Sayad. We gave them the literature provided to us by Rebecca from the department, and we just converted that into the Maimai language, and we passed it through WhatsApp groups that are organic. Early actions we took on March 24th, and we learned about the pandemic in March 17th. March 24th was our first distribution to 350 families, in which we passed not only food enough for 1 month supply for a larger family, we also passed $14,000 in cash assistance. I gave $50 cash assistance to each family that showed up that day. That was to cover the cost of their formula milk, for diapers, for those things that I could not give to every family.
Thank
and then
you,
we also asked.
Zerqa. In the interest of time, I'm going to go ahead and ask you the second question because some of what you're sharing addresses that question.
Okay.
So the second question is, how are elders and young people in your communities being affected by COVID-19? And these are just kind of quick rounds of answers, please.
Okay, I'm sorry.
What you have to share is very important. Thank you.
Yes, I think the elders are big. The major impact on them is lack of information and misinformation around COVID. Unemployment or smaller checks are affecting all households. Mental health, depression, healthcare screening and support for the elders is of course very, very low. So that's a major issue. Their appointments have been postponed for too long, and they are not getting that help in their homes, or they are not able to reach their, for regular health maintenance. Housing eviction, lack of maintenance in the housing is also because the maintenance crew is also not showing up because of COVID issues. Young people, online schooling is a huge challenge. Devices, internet connections, lack of space in house, lack of supervision, language and technology barrier on parent side. So if parents don't know, they are not able to help. No school, no activities means rise of drugs and gangs and gang violence. 2 teens homicide already happened during COVID is in April and June. Recreational activities, they need help with that. Soccer league and running project were especially launched during COVID because of that. And I think our grassroots work with the community directly in engaging them is the one major success that we had. Otherwise, it wasn't going in. It wouldn't be successful. I just want to say very quickly that I think the early action we took, especially around food security and PPE supplies, which we did supplies to about 78 organizations and 2,000 families. And that has helped in keeping the numbers of the COVID cases in our community that we serve very low than compared to the other communities in nearby.
Thank you so much, Zerqa. And now I'm going to ask a question of Hodan. Hodan, could you share how elders and young people in your communities are being affected by COVID-19?
Thank you so much again. I hate to say this, but so far I heard for the last 3 months, I heard from 4 different families that contacted me because they lost their sons because of gun violence or drug issue, and it really hurts. That's why we created Friday Day just for youth to find out what we can do about it. We're still negotiating and talking about what we can do now. Before it existed in 2017, we created that Our Light program that was funded by the City of Columbus. Thank you, City of Columbus, and it was very successful. It reduced the gun violence, but because of the pandemic, the program was not done in 2020. And I believe that is the problem, why the killing and gun violence came back again. We're hoping to find a way to do it in 2021. But now we're still talking about what can we do during the pandemic problem and how can we keep them busy, because that was the biggest issue when we talked to the youth. They were like, we have nothing to do. We don't have programs. We're free. So we're still talking about it, and I will share with the outcome.
Hodan, you seem to be frozen.
That doesn't. Okay. For the seniors, their biggest issue is isolation. They're isolated. They live by themselves. COVID is killing them. We hear a lot of senior people within the community dying because of COVID. I don't have the numbers. I think Rebecca does. You're from Columbus Public Health, but yes, isolation and mental health and phobia, not going to a doctor's, it's a big problem for the seniors where they just want to stay home. They're like, no, I'll be locked in the room. I don't want to go to the hospitals. So let's keep doing the awareness, and I appreciate the videos that was already created, and we need to do more. And if we can, do it in person, talk to them, knock their doors, maybe talk to them out of their doors, stuff like that. But yes, they're having big issue too.
Thank you, Hodan. Sudarshan, would you like to share a little bit about your perspectives about how elders and young people are being affected in the community?
Sure. I really want to quickly recap. I think I missed some portion on my first question that I left for the second part, I guess. Yes, obviously, I was trying to bring the issue of the COVID challenge, and that has really put a strain on the organization financially, just pretty quickly. And although we were able to manage finances in the 2020 through help from the Columbus Foundation, United Way, and the Health and Human Services Refugee Resettlement Program, and we're able to keep the program as it is in the year 2020. But moving forward in the year 2021, I have already started, I may have to downsize my staff members and things like that. And we are not sure about the funding and program that we could continue. And in the midst of that COVID, we were able to bring together community volunteers. There were over 200 volunteers to help with the COVID projects. We actually trained over 15 nurses here in Central Ohio, and with the help of 2 primary care physicians, Dr. Podel and Dr. Mohammed, we were able to provide intensive COVID relief project into the community, and we were able to distribute PPEs, groceries, and one-time financial help to over 500 families in the meantime. And also we were doing a PPE drive away every other week. We appreciate the videos produced through the City of Columbus about the COVID education. At the same time, I was interviewing the primary care physician and doctors to provide up-to-date information into the community, creating videos and so on. So respecting the time. So recently, what we had seen with our elderly folks in the community is the lack of transportation, especially. They are isolated, they have mental health issue, and of course, because of the language barrier, they were not able to get the healthcare service that they would need otherwise. And especially, so many elders had to come back even when they had a COVID because there was no one to communicate with them. I really want to quickly share one story. It's very chilling, but I wanted to make a point here is there was an elderly gentleman and he was diagnosed with COVID and sent to hospital. The family member forgot to mention that the person was he had asthma for a long time, and they forget to mention about the inhaler. He went to hospital. He could not speak to the nurses because of the language barrier, and he needs the inhaler. And somehow there was a gap in the communication. After 3 days, the person was declared dead. Now, did that happen because of the COVID, or did that person didn't have the inhaler, and then it became a complicated issue? So this is just one example, and there are many examples where we could not meet the needs of the elderly population because of the language barrier, and COVID, of course, make it very complicated. I'm not blaming the healthcare system. I think they are trying to do the best. So this is one of the areas we really have to look into the elderly population. With the youth, we have seen, I think, across the communities, whether that's the Somali community, Middle East, or our Latino folks and friends, we have seen among youth is the gap in the education, mental health, substance abuse. This is the common theme. Last year, we had seen deaths by suicide among the youth, the number growing, but this year that number isn't growing as it used to be, but we had seen cases of substance abuse and addiction. And one of the biggest things that we are worried about is the gap in education system that could lead to, future difficulties. But the list, as I said, the list goes on and on. But one thing that I really wanted to underscore in a minute is these challenges that we have seen in the witness communities are pretty much similar to what my friends are seeing in their respective communities.
Thank you so much, Sudarshan. Ramona, I'm going to ask the same of you, but also lead into the question that council came up specifically for you because of your dual role. Not only are you leading the services at the Our Lady of Guadalupe Center, but you're also a school board member. So we're interested in your perspectives very briefly, please, about youth and elders, but also in your school board member role. Could you please share with all who are watching this program today what resources have been made available to families during the pandemic, and how can we access them?
Perfect. Thank you, Rebecca. First, as my other colleagues have mentioned, very similar challenges for our community. When the COVID hit, we had a lot of our volunteers who are elderly and could not volunteer anymore. But we saw a increase in the ask for food. So our kids are home, more families are working from home, and or they lost their jobs. So we needed to make sure that our the food insecurity was covered. So we increased our the meals that we provided from 3 days to 4 days worth. We also knew that churches and other entities were providing food, but not a lot of the Hispanic ethnic type of food. So we also reached out to a produce person, and we're able to acquire the yuccas and the avocados and the types of fresh fruits and vegetables that our families are more used to ensure that our children are eating the healthy foods. Our ESL classes went online, but what we discovered was that a lot of our elders and our students needed to learn how to utilize Zoom, how to utilize the internet, how to create just a email address. So we actually transitioned, and we're kind of becoming IT professionals per se, and we're directing our clients to utilize Facebook and the internet as ways of us sharing information. If we got something from the Department of Public Health, we were promoting it on our Facebook and making sure that we had those linkages in the appropriate languages. Additionally, we also had a lot of issues with people not understanding our benefit system. So we quickly had to address and become benefit interpreters, I guess you could say, and helping people with PRC, Medicare, Medicaid, all those benefits that are out there. If they qualified, how do they interpret them? How do they qualify? Who has them available? How do you fill out an application if you've never done so before? Explaining emergency cash assistance for those impacted by COVID, but also unique to some of our clients is explaining the public charge and the implications of what public charge would have if somebody is looking for residency or citizenship in the United States. So that was something that was very difficult for many of our clients to understand. Again, we went with increasing the technology use of technology. We were making announcements. We actually were getting to the point where we were getting 5,000 hits on most of our announcements, which was very unique to our Facebook. We also had job referrals, housing, on-site flu shots, and legal assistance. So all those things increased. We saw about 35 to 45% increase in needs amongst our folks. I did want to thank the assistance from the city council, the county. We received some of our CARES money. Many of our elderly, because of the immigrant status and the courts closing, we were not able to provide, they weren't able to go to immigration court, so a lot of their residency and citizenship was out in limbo. So through some of the foundation monies, we were able to serve 95 families and prevent evictions, utility cutoffs. We had a lady who we've been corresponding with via text, who went to eviction court after we had made the arrangements with their landlord to not evict them, and through a translator were able to communicate with the judge and stop the eviction. So there's a lot of language barriers and amongst our elderly and our youth, access to technology. As for Columbus City Schools, this is actually perfect timing. So tomorrow, Wednesday, we are dedicating it to We Care Wednesday, and we're planning, Columbus City Schools, along with several volunteers in our community, are planning to call every student household in our district, and we're doing a check and connect call. So we want to hear directly from our families, make sure that they do kind of a well-being check, answer questions, connect them with community resources and the supports they need, connecting them to 211 to ensure that they have access to food, healthcare, utility assistance from several organizations. So tomorrow, between the hours of 4 and 7 p.m., please, families, answer your phone. You may get a phone call that you don't recognize from a phone number. Please know that that's our volunteers, our staff, the district, giving you a call, making sure that everyone is doing okay, and if they need assistance, that they have the connection to those referrals. If there's any questions, please visit the Columbus City School webpage. If not, you can also send an email to engage@columbus.oh.us. I'm sorry, columbusK12.oh.us, and we should be able to give you some resources that you can access. If you forget everything I said, you can also just call 3 simple numbers, 211, and somebody will be able to help you at that number.
Thank you, Ramona. Zerqa, food sustainability has come up across a number of conversations already today. We know that My Project USA has been active in addressing food access concerns. What concerns around food access specific to the communities you serve should be on our radar?
Of course, food insecurity and absence of healthy food. It's not just that what the food is not there, but also when the food is there, that's not a healthy food. So Sullivan Avenue area, Hilltop area is already food desert. Our pantry has been serving for 4 years, and we have served like 3 million, almost 3 million meals and snacks. But COVID has doubled that number of clients. We were serving 150 families, and we served up to 300 families or certain weeks during COVID. So that is a major issue. What City Council needs to know, and we wrote a letter from Hilltop Area Commission also to City Council, was about that My Project USA changed the gear. We bought equipments. We took the bigger place because of COVID. There was safety issue. There was drive-through issue. We couldn't block the Sullivan Avenue. So we are on a bigger location. And with partnership of Food Bank, we are now opening a free fresh produce market. And not just fresh produce, we will be funding it and bringing more dry staples. It will be open throughout the week. We need City Council. We need City to support this project. Similar project with millions of dollars support has been supported by the City of Columbus in the Linden area. Hilltop is suffering. Our families are suffering. One major thing through COVID was that if there is food at home, they will stay at home and they won't go out and get COVID. So this is something that we really need you all to understand, that all that sex trafficking, all that drugs, everything, and homeless people on the road, we can help them. We are all Hilltop leaders are working on it, but we need support for our operation. We need support to at least open it to a decent place and get it done. And we got that location. We already have some stuff done. And we need a swift action from City Council and the Mayor's office to support us for our operations so we can really serve the larger Hilltop area throughout the week.
Thank you, Zerqa. Hodan, you already brought up quite eloquently the concerns around violence. This question is coming back to you. How are your young people doing around mental health, addiction, and violence? And if there's any more that you want to share with us, in addition to what you've already raised. Thank you. I think you're muted. Okay.
They're doing horrible. That's really bad. It's not looking good. But we are, as I said, we dedicated to talk about this and see what more we can do for the young people. Like, for example, all the activities are suspended due to COVID-19. Young people are already addicted to drug, most of them. On top of the 4 that lost their sons, I had another 2 families that contacted and said, my sons are sitting home because they said they get a call from other young people, said, whenever I see you, I'm going to shoot you. So I'm afraid my son is next. The other issue is young people are afraid. They don't want to share who wants to kill them, but they know who's killing them. So we're now working on creating a team to work on this. Sorry about that. So we're working on a team. So if anyone wants to volunteer or have resources about this, please contact us. Contact me or contact Laura Berger, or Rebecca is going to share my information with you. Please, we need your help.
Thank you, Hodan. Sudarshan, you alluded to this earlier. Is there any more you would want to share about the challenges that your families who live in multi-generational households are facing?
Yes, thank you once again, Rebecca. I think, I would really wanted to echo the issues my friend brought today in this conversation. We, as immigrant and refugee, face similar issues, so I don't think I have to repeat that one. We have a very unique situation with the Vietnamese Nepali community, which is a multi-generational families living together. And of course, in a good time, what happens is multi-generational family is a very economic way of, saving resources and then coming out of that poverty and whatnot. But during the harder time, it becomes a liability because there are younger folks who need to go to school, who need to go to work, but their elderly parents is staying at home at the same time. Now, the biggest fear that we have, and I am practicing the same thing, is we may end up bringing disease to our elderly parents. The kids go to school, they have to go to school. There are kids, they don't have to go to school in certain district, but the working generation, that my generations, a good majority of them work in warehouse and whatnot. They are being an amazing employee. But because of that, the situation is that they could bring COVID anytime. And not only could bring COVID anytime, we had seen a spike in death in the Vietnamese community among elders. And we track those, the COVID cases to some extent. And then we found that the sources were coming all from the workplaces. And especially in the early times of COVID spikes, we had seen from the meat processing factories were contributing to a large number of COVID cases in our community. And that has continued on today. And that's the risk. We are losing our older population. Now, here's the take. Our older population do not live in nursing home. Exclusively, they stay at home because of the cultural practice. Now, what should we do when this COVID vaccine is coming? How do we prioritize this older population living at home with their family members, getting COVID vaccine as soon as possible? So my concern here is this vaccine may be going to nursing home, which is excellent. It needs to go to nursing home. It needs to go to the healthcare worker, frontline workers. We really appreciate that. But please do not miss out this elderly population living at home with their families, and they have a high chance of contracting COVID than the other elders who are living in nursing home care, because they have, very educated, they have a healthcare worker taking care of them. They can create an atmosphere where COVID may not come in, right? That they could create an environment within the nursing home and whatnot. But in the homes, as I said earlier, the chances of reducing the COVID to come inside the home is very, very, very small. because they have to go outside, they have to do work, and they could bring COVID very easily. So this is one of the biggest concerns that I'm worried about. We are happy to partner with City of Columbus Public Health. We are working on that one, and also with other partners. We really wanted to thank, it'll take a long for me to name everybody, but yes, my project USA have been amazing, supplying us with PPEs and whatnot that has really helped us. City of Columbus, the CareX, Columbus Foundation. But we need to continue supporting these agencies as well. If I don't pour money into the Columbus Foundation or United Way, they are not able to support us. So that is what we need to do, is support these organizations so that they would be able to support us. So this is a harder time. This is a difficult time. Everybody needs to come together. And also the other message that I really wanted to send is, as a small community-based organization, we need to find a common table. We need to find an association type and discuss our issues and how we can help each other. I may be very good at doing certain things, but just like my project USA is good at bringing those resources. So how about we collaborate each other? I think this is very important thing: collaboration, helping each other, and supporting. And really wanted to really say one more sentence, is that City of Columbus need to really look into this one through a newer perspective. They have been doing an amazing job. I really wanted to say that they were great help, but 2021 is going to be a much difficult time because people are exhausted, resources are exhausted. And in my small community, we were able to get donations up to $18,000 when we were going through a very hard time. But these folks don't have money anymore to spare to us. And we have to close down now 2021. So we really have to work together and plan for 2021. That's my message.
Thank you, Sudarshan. I'm going to combine our last two questions, and I'm going to ask everybody to try to respond to it in 2 minutes or less, if possible. And I'm going to kick it off with Ramona. Are there any additional issues or concerns that you want to raise? And how can the city be a better partner? Ramona.
Thank you for that question, Rebecca. So yes, even though we talked about all the things that we did to pivot, and we have these systems that are now built and they're ready to go on an ongoing basis, we continue to partner with agencies around the state for mental health due to limited culturally appropriate and Spanish-speaking social workers or counselors. So we're trying to, that's one of the items where we would need some help. A lot of our referrals go to agencies, and there's very limited help. They don't have a Spanish speaker. They have to wait for a translator. And this is something that we have to partner throughout the whole state. So we have had to make referrals up to Cleveland, up to Cincinnati, because of the lack of assistance here in the Columbus area. We are working with Adam H. We received a little bit of funding to provide the Latino Mental Health Navigator program here. But that's definitely something that needs funding, I'm sure, within many of our communities. We are seeing a downstream impact of things like a massive outbreaks between the Hispanic community. So we need to get the information out. Our community is very good at having teas and home remedies. That's a part of our culture. That's what we bring from our Central and South American roots. And what happens is we're doing that and at home, and by the time we get to a hospital or to a doctor, which we have lack of medical coverage, many of our families are passing away because it is way too late for them to get that assistance. So help with getting that information out in the culturally appropriate language, whether using the broadcasting tools that the Columbus City Council has, that would be wonderful. Very similar to other organizations, we are seeing the multi-generational families and mixed families moving together, but we're also seeing mixed families, people that don't even know each other, that maybe they're meeting at eviction court, and so we have strangers now actually living in the same household because they don't want to go and are very familiar with our homeless population going out and being in a shelter. They don't want to go there. They don't understand that. They're very fearful. So now they're combining, and the need for some of these very welcome city cares, county cares, those grants that have been able to assist our community are really warranted at this time, so that we can prevent, again, evictions and utility cutoffs. Thank you for the opportunity to share and talk a little bit about the Our Lady of Guadalupe Center and its needs.
Thank you, Ramona. Hodan, are there any additional issues or concerns that you want to raise at this time? And how can the city be a better partner?
Thank you so much. The same thing. There's a lack of culturally appropriate services for the community of color, and we need that to be changed. And I think the best way that the City of Columbus can partner with this issue and resolving it is support the small organizations that are serving within their community. So the problems cannot grow. The problems can at least be reduced. If I give you an example, in 2017, when we lost 9 young people within a couple of months because of gun violence, we have been meeting left and right. And then finally, I personally and my team decided to do something rather than just meeting. And we did talk to them face in face. They're not going to come and talk to the police, but we sat down with them, with the people that are doing the problem, and we asked them a couple of questions like, why are you doing this? What is your problem? What are you lacking? And after having that conversation with them, we created our light program, which was what they were missing, a program that has a basketball, which is activity, and workshop to reset their minds and hearts. And that resolved a lot of that problem. We did not lose one single young person from the community in 2018 after that program has been created. So I'm not saying it's going to be resolved 100%, but for sure, when community gets a culturally competent problems will definitely be reduced. It's the same thing, but also interpretation surfaces. It's really a big problem. There's organizations and the companies that try their best, they do their best, but the person that's making the decision themselves do not speak the language. So when the person speaks with them in English perfectly and say, yes, I know Spanish, I know Somali, they just try to test them through a computer. They trust them, but you will see a lot of young people that do speak good English, but do not speak Somali, that are translating for people. And they make some mistakes, which leads and misleads the community. So I would say let's do better together.
Yeah. Thank you, Hodan. Thank you. Zerqa, I'm going to turn to you next. Are there any additional questions or concerns that you want to raise? And how can the city be a better partner? And that's a big question to do in around 2 minutes.
Okay, yes, and I will try to be very quick. So number one thing is operation money. We have got money for food, for cash assistance, to take care of the clients, to take care of things that we needed to pass. But then where is even for PPP dollar I got, but how do I pay rent and utilities and things to keep them employed is the problem. And I don't know, if I spend it, all of it, just because I can pay rent for 1 month, then what do I do the next of the following month? So this has been a huge problem all over. Then grassroots organizations, I really want the City of Columbus and all Franklin County, everybody to really look into organizations that are actually working with ethnic communities and they have a track record. Because when you're giving a lot of money to Urban League or any other, Hodan Mohammed or Zerqa Abid do not get that portion of money that we need to stop gangs and drugs and everything. I've been reaching out to Urban League, I've been reaching out to all other that are getting big dollars. They are being used. I'm appreciating their efforts. But then what do I do for my youth? I don't have it. Right now, I have no money for soccer league starting next month. And soccer league has saved hundreds of children right now during pandemic. It has stopped that gang violence that has started. That's one thing. So don't make the big organization bottleneck and that doesn't come down to the place where it needs to be. Human resources grant was extended third year this time, and that means that anybody who missed, my Project USA was one that missed that deadline 2 years ago, we are not getting it again. So we don't know what to do with that dollar. Auditing and auditors and accounting, that's additional expense if we have to qualify for federal grants or state grants. That money we don't have. Can city hire some company? Can city give us some grant so we can do that auditing and accounting process? I am not sleeping overnight because I have to keep everything in place. I don't have money for accountant and I'm always behind. The last thing I would say, elderly at home thing that Sudarshan raised up. I have an 80-year-old mom at home. My daughter came from Thanksgiving weekend. She came from college. She tested positive COVID later. I am in the middle. We have been doing everything we could do, but my mom is at home and we are just struggling how we keep a balance. And when I'm very educated and I know what to do. So these are real issues. Can Department of Health can go to the state departments or whatever and have a program, especially for multi-generation homes like ours in immigrant community, because I cannot send my mom to the nursing home. She will die in 2 days because she won't understand. Nobody will understand her. And those are real challenges. Thank you.
Thank you, Zerqa. Sudarshan, we're going into the home stretch with you, my friend. Are there any additional issues or concerns that you want to raise? And how can the city be a better partner?
Yes, definitely. Two things I wanted to bring. One, I really wanted to restate what Zerqa said. These are very important. So I don't have to restate it. Thank you for that one. The other thing that I wanted to mention is when it comes to providing funding, these small community-based ethnic organizations should be on the table when these fundings are provided. For example, let me give you an example. My community has these mental health challenges, and everybody knows that. And when Adam Board was putting aside funding to provide mental health services to Bhutanese community member, the funding goes to a third-party organization that they can't even speak the language. That's not we are going to solve the problem. The refugee community organizations, ethnic community organizations are stakeholders. They need to be bring into the table and ask the question. The funding, of course, I appreciate the funding goes to the bigger organization as well, but that's not helpful. And I wanted to bring one point here. We should think refugee immigrant communities as partners, okay? Why? Because in 2016, Chris does the refugee impact study, did the refugee impact study, and they found every year refugee community is contributing $1.6 billion to local economy, billion with B, okay? In my community, Bhutanese Nepali community, we have calculated roughly Bhutanese community brought over 3,000 homes in the last 5 years, and then the average cost of home is $175,000. If you just calculate taxes that they paid, it's $36 million. Just taxes only, I'm calculating. And refugees are contributing heavily to local economy. They are not dependent. Please, just correct your language. They are not dependent. They are supporting. They are keeping the economy going on. They are adding dollar to the local economy. But when they need help, where is the money going? We really have to be in a table and be honest and in this conversation. If refugees are contributing to local economy during the harder time, the local cities and agencies and organizations and counties need to give back to the refugees as well, so that they are better enough to give back to the bigger economy tomorrow, right? So this conversation has not gone anywhere. We are seen as dependent. We are seen as asking for handouts and things like that. But really, we are contributing. We are making these cities stronger, counties stronger, financially, economically, and then the list goes on. That's why we wanted to bring more immigrant communities in Central Ohio. The city has done a great job, but at the same time, we have to be mindful about their needs. And this needs is not only with the Bhutanese community, it is with the Somali communities, the Middle East, the Latino, everybody. And we as an immigrant community are often not given the same priority when it comes to allocation of funding. That's true. And also this study was done by actually Ohio State University, and they have found gaps in the funding process. So we really have to sit down and make this clear, and we are a partner. We are a very strong partner. We wanted to build Central Ohio economy, but during the harder time, city and county need to really look into this community the way it needs to be seen. So that's what I wanted to say. today.
Thank you so much. That's a good place for us to close out this part of the panel. I want to take this opportunity to thank each of our panelists for spending time today, sharing your perspectives, and most of all, being the advocates that you are throughout our communities in Central Ohio. Thank you so much. We had limited time today, but I've heard that there will be future opportunities, future roundtables. And at this time, I'd like to turn it back over to our host for today, Councilmember Remy. Thank you.
Thank you so much, Rebecca, and certainly thank you, Hodan and Zerqa, Shud, Ramona, all of you for providing your insight into your communities serve every day, and it's important to hear your messages as we listen to the questions that were asked. I want to make sure to mention, Rebecca, how thankful we are for your partnership, not only for this event but also for the COVID-19 safety and resource PSA videos. Look forward to working with you on the vaccination videos as well. We could not have created such an informational and culturally appropriate videos without your help. So thank you. We did receive a few questions, but I want to focus on one right now and maybe ask this of the entire group. This is from Marilyn Sanchez, an outpatient clinician at Centero. Is there any work being done to help people who are undocumented get access to other services that documented people have access to, especially around COVID-19? I recognize there's some nuances and sensitivities with this question due to the public charge rule, but kind of open it up, and anyone that can answer, we appreciate that. Rebecca, do you have some insight first, and then I'll throw it to Ramona and Zerqa.
Absolutely. I just want to say, first of all, our Women, Infants, and Children program, which is so necessary for early childhood development and health. I encourage all families to look into those services. All right. The second thing that I wanted to share is the 211 number has been raised several times already, and that's for everybody across the county. But if you are a family member who lives in the city of Columbus, we do have our social work helpline as well, which is 614-645-6807. And our social workers can help with referrals as well. And I think it's a point of pride for us in public health. Our services are open to all. I want to say that again, our services are open to all. And at this time, I'd like to lob it on over to Ramona.
Thank you. Thank you, Ms. Sanchez, for that question. It's very well warranted. There are some services that are available to undocumented individuals. I'll mention some, and then I'll also give the phone number to the Our Lady of Guadalupe Center. There are some private funders who have provided unrestricted funds that can help with rent and utilities. There are some organizations that help directly with pregnant women that are sponsored by the city. There are some hospitals that provide assistance from anywhere from medical, everyday primary health to flu shots, COVID testing, and mammograms. So many of our major hospitals provide mammograms for free to all who need it to ensure that we are succeeding in the battle against cancer. So there are some resources available. We can also answer some questions here at the Our Lady of Guadalupe Center at 614-340-7061. I will say that they are limited, and just as even some of the COVID and government funding, there is an application process to ensure that agencies are helping as many people as possible and having a greater reach.
Thank you, Ramona. Zerqa?
Yes, so the food bank changed the policies of, showing the IDs and all those details earlier on in COVID, and it was also drive-through. So that also has enabled us to pass the food to whoever comes to the pantry. But in addition, My Project USA has the same thing. We raised money separately. We raised about $150,000 this year from online and other contributions from Facebook, and we also did some fundraisers. So our policy is that whoever comes to our organization, we serve them. If they are documented, they may be sent to Impact, another organization. But then if there is nothing else, we work with Noor Islamic Cultural Center and our own private funders, and we make sure that we can pass. For example, the $50 cash that I passed was from the private donations, and that enabled me that I didn't have the documentation because it was giving out like whoever is coming, and we saw them. So yes, and also it's not just about the undocumented. Actually, what I said about the bottleneck part is that $1 million have been given to certain organizations to pay the rent and utilities, but there is a bottleneck issue is that they are understaffed, they are not responding, the cases, the duty bills are deadlines. So we are even paying for those who are actually eligible, but then there is no response from actually what Franklin County or the city of Columbus is thinking that the organization is taking care of. And I've been talking about this constantly because our communities, our immigrant refugee community in Wedgwood, there is nobody who would help them with the rent because there's no table there. And why they would get the support when they are getting into the court? They need support in their own homes because it's COVID. So that has been an issue. So our policy is, and there are many other organizations I know, especially Islamic Muslim mosques, are providing services to whoever is coming. So thank you for that question.
Yeah, thank you for the insight. We certainly are learning a lot here today. Let's see, I wanted to also bring up, I was happy to support work alongside Council Pro Tem Elizabeth Brown, who really spearheaded the Right to Recover program. It's a one-time emergency financial assistance for those things related to COVID-19. And that program is being ran through Catholic Social Services and the Urban League. So you can find more information at columbus.gov or by reaching out to either one of those organizations. Another program that's relevant to this question is the Columbus Families Together Fund, and that helps to provide pro bono legal service representation to immigrants who are detained. Thank you again for everyone and your time today for joining us. To all of our panelists, Zerqa, Houleye, I started down the path here. I'll read through it all again. So Tarik, Ramona, Shud, Rebecca, Hodan, I think I got everybody there. We really thank you for your honest and thoughtful responses. We truly have great community leaders working throughout our city, and it was especially nice to have all of you here today with us. The information you've shared may be new to some of our viewers, but it is daily reality for many in our community and those that you serve. That is why my fellow colleagues and I at Columbus City Council continue to work hard to serve our residents and help support our partners who directly work with those struggling during the COVID-19 pandemic. Thank you to Carlos and Alan with CTV, Mark Carter with Technology, Angela Burks, Avery Townsend, Lee Cole, David Miller, Sandra Lopez, Aaron Gibbons, Jeff Carter, and Lucy Frank from Council, my team. And again, thank you to Rebecca Nelson, Columbus Public Health, for helping put together this roundtable discussion. To everyone watching this COVID-19 Immigrant and Refugee Roundtable, thank you for joining us to hear about this critical information. This roundtable was recorded and will be available to share following the close of this event. We hope you will share this in our COVID-19 Safety and Resources PSA videos with anyone who could use them. In closing, we are still in the middle of this pandemic. All of us must continue to wear masks, wash our hands, practice social distancing, don't mix households as far as inviting company over. Stay isolated amongst yourself and stay home as often as possible, especially as we're approaching several holidays in the next couple of months. We want to show one more of the videos produced and filmed by Tarik Tarey. Here is the Spanish video. Thank you, and we look forward to our next discussion.
Hello, friends. I'm Columbus City Councilmember Emmanuel Remy, and today I'd like to bring you safety and resource information in your native language about COVID-19. We value everyone who calls Columbus home and hope that you find this information useful. On behalf of Columbus City Council, please stay safe.
Mi nombre es Alma Díaz. Soy un miembro de la comunidad. Vivo en el estado de Ohio. en la ciudad de Columbus y en el condado de Franklin. Este día estoy haciéndoles una invitación a todos los latinos para que se unan a esta campaña de usar la mascarilla. El estado está teniendo los números más altos del COVID. Nosotros podemos pararlo. Usa tu distanciamiento social y lávate las manos por lo menos 20 segundos con jabón. Usa la mascarilla. Esto nos puede ayudar a prevenir de que sigamos con los números altos. Es nuestra responsabilidad. Paremos a las fiestas grandes, a los bautizos, a las congregaciones en los nightclubs. Esto tiene que parar. Cuidemos a quienes queremos en casa. Cuidemos a nuestros amigos, a nuestros hijos, a nuestros padres. Prevengamos, el COVID está incrementando en el estado de Ohio. Los hospitales se están llenando de camas. La gente está muriendo. Gente a nuestro alrededor. El COVID, el coronavirus, el COVID-19 existe. Tenemos que ayudar a parar a este virus. Por el bien de nosotros, de nuestra comunidad, de todos los que queremos, por favor, usa esta mascarilla. Esto es lo que debes hacer. Esta es la mascarilla. Hay diferentes tipos de mascarillas. Lo único que tienes que hacer es usar la mascarilla apropiadamente. No debajo de la nariz, no debajo de la nariz, no debajo de la barbilla, no en tu bolsa, no tocarla en diferentes partes. Es usarla correctamente, cubrir tu nariz y tu boca. Cuando comemos, cuando hablamos, el virus puede entrar por tu nariz, puede entrar por tu boca, así que el uso correcto de la mascarilla es tomarla y colocarla de esta forma, cubrir la nariz y cubrir la boca. Los síntomas del COVID-19 o del coronavirus son los siguientes. Muchas personas pueden tener diferentes síntomas, pero tenemos que tener mucho cuidado en estos. Si te duele la garganta, si sientes dolor de cabeza, si tienes fiebres altas de 105 a más y tu cuerpo lo sientes extraño, pueden ser síntomas parecidos a las de la gripe, pero hay que tener mucho cuidado. Personas han terminado en el hospital usando inhaladores artificiales o conectándose a una máquina. Tienes que hacerte el test si sospechas o has estado al lado de una persona que ha sido diagnosticada con el COVID. Hazlo por tu familia. Acá hay lugares cercanos donde tú puedes ir a visitar y no tienes que hacer cita ni tienes que tener una prescripción de un doctor. Los números aparecen acá. Contacta a este número y hazte la prueba. Si vives en el condado de Franklin, existen 3 lugares donde puedes hacerte la prueba del COVID-19, del coronavirus. Esos lugares son los siguientes. Y si hiciste el test, por favor, quédate en casa 14 días. Probablemente sea necesario que vuelvas a repetir el test. Si los resultados de tu prueba del COVID fueron positivos, por favor, contacta a la línea de ayuda y contacta a las personas con las que estuviste en contacto. Evitemos propagar más el virus. Es nuestra responsabilidad. Es muy importante que uses la vacuna contra la gripa. Si tienes alguna duda o pregunta, puedes contactarte al Columbus Health Department, al Departamento de Salud de la ciudad de Columbus, o llamar al 211 para más información. Yo soy Alma Díaz. Muchas gracias. Por favor, todos contra el COVID-19, todos contra el coronavirus. Paremos esto.